Yeah, shoulder pain may arise from the shoulder joint itself or from many surrounding muscles, ligaments, or tendons, according to my clinic. Since the shoulder is the most movable joint in human body, it's commonly found across different age groups of different lifestyles. Shoulder pain that comes from the joint, it usually worsens with activities or movement of arm or shoulder. The first symptom is warmth or redness in the shoulder, neck or upper back pain, arm also, limited range of motion as a movement of the joint, a cracking sensation when moving the arm, when you hear like cracking, and then muscle stiffness and weakness. The most common cause of shoulder pain is rotator cuff tendinitis or bursitis, which may be due to keeping arm in the same position for a long time by doing computer work or hairstyling or sleeping on the same arm each night, what we call repetitive trauma. Similarly, playing shoulder exhausting sports such as tennis, baseball, swimming, and weightlifting. The second common cause is rotator cuff tendon tear, when the tendon is torn due to overuse or fall on the arm while stretched out or after sudden jerking motion when trying to lift something heavy. Other causes of shoulder pain can include arthritis, bone spurs, bony projection, broken shoulder bone, and shoulder dislocation. Also, frozen shoulder, when the muscles, tendons, and ligaments in the shoulder become stiff. There is what we call 4 types. The first thing, aching shoulder pain, such as rotator cuff tears, sharp shoulder pain, such as frozen shoulder, shoulder impingement syndrome, or arthritis. Third one is shooting or radiating shoulder pain, originating from damage or pinched nerve to the arm or neck, may associated with numbness or burning sensation. The fourth one is warm or burning shoulder pain, such as shoulder bursitis or rheumatoid arthritis or infection in or around the shoulder joint, reflecting inflammatory response. Yeah, shoulder pain is commonly caused by trauma to the shoulder area, such as rotator cuff injuries. It can also occur without injury, such as what we see in osteoarthritis. In some cases, shoulder pain may be referred that the pain felt in the shoulder is the result of injury of another part of our body, such as neck or lung. But the pain at rest and no worsening of pain when moving the shoulder. What's mean that the pain, if it's from the shoulder, there's more pain during the movement. But if the pain from outside the shoulder, there is no relation with the pain movement. Depending on the cause, bone, joint, muscle, tendon, or ligament related, bone or joint related causes may require surgical or orthopedic intervention. The conventional therapy depends mainly on non-steroidal anti-inflammatory drugs. Other non-drug-based treatment methods, such as activity modification, such as resting shoulder and avoiding the activities that cause pain. Physical therapy, applying ice pack 20 minutes at a time, 3 or 4 times a day. And due to their inadequate relief of non-steroidal anti-inflammatory and their adverse effects, educated patients refuse taking them. Instead, they look for non-drug and non-invasive therapies for shoulder pain, such as complementary medicine, including low-level laser acupuncture. The complementary method, just I give example, chiropractic, osteopath, Alexander technique, reflexology, acupuncture, and electroacupuncture, low-level laser therapy. The advantage of low-level laser therapy, it used about 30 to 40 of clinic for physiotherapy or sports. FDA approved that low-level laser has non-significant risk device, which would they can use it to treatment of painful condition. Several studies found that there were no difference in anti-inflammatory effects between low-level laser and non-steroidal. It usually takes several sessions, up to 20. However, I modified the low-level laser by applying it on acupuncture points with pressure to reduce the sessions to one or two with pain reduction. I describe this as Dhiya low-level laser acupuncture or acupressure. And it is integral part of strategy used in my clinic, which I presented in international conference. It's easy, fast, shorter treatment times between 5 to 20 seconds per points, while needle retention time is 30 minutes. Laser needle continue much longer, but rise during the whole treatment. The mechanism now, because some people said, what the mechanism of laser acupuncture? Now, as we know that acupuncture points are places where nerves, muscle, and connective tissue are stimulated to boost the activity of our body natural painkiller, which call endorphin, and increase blood flow. It acts as complication-free anti-inflammatory agent, both modulate cytokines and chemokines levels, encouraging resolution of inflammation. Now, I carried out a study to determine whether a single session of low-level laser acupuncture therapy for supraspinatus tendinitis will result in better outcome than using acupuncture needles. I conduct patient divided two equal groups, both groups stopping their drugs. All patients receive only one session on local points, distal points, and auricular points, whether low-level laser acupuncture used or standard needle acupuncture. And the physiotherapist who was not aware from therapy undertaken evaluate the patient before, immediately, for 12, 24 weeks after.